joining us for today's virtual media briefing about COVID-19 in London and Middlesex County. We're glad to have you along. Also happy to be joined this afternoon by the Mayor of London, Ed Holder, and the Associate Medical Officer of Health at the Middlesex-London Health Unit, Dr. Alex Summers. A welcome to those tuning in this afternoon on Rogers Television, as well as the Rogers Facebook page and YouTube channel, listeners on Global News Radio, AM 980 CFPL, and those watching on the CTV London website. And I do also want to welcome the media who are in attendance today. We thank you for joining us. And again, if you would like to submit a question for one of our guests, one of our panelists this afternoon, just click on the question mark in the text bubble here on Microsoft Teams. And when you do submit that question, if you could indicate your name and your media outlet, as well as who your question is for. Let's get to the opening remarks right away. And we'll start with Mayor Ed Holder.
Well, thanks, Dan, and good afternoon, everyone. You know, for over a year now, much of the community has been totally focused on case counts. How many COVID counts have we had today? How does that compare to yesterday, and so on? Well, I completely understand the interest in this metric, but there's one, frankly, that we'd better all start focusing on and appreciating more, and that's hospitalization rates. As of today, there are 57 COVID patients at LHSC. That matches a record set in early December. Of those, 24 are currently in ICU, and that's an increase of 6 from yesterday. Case counts are one thing, but when more people are winding up in our hospitals, some of them for prolonged periods, well, that's where even the most dispassionate or disinterested observers should sit up and take notice. Because when it gets to this level, and we're seeing record ICU numbers across the province, that's when it becomes about the healthcare system itself. Not just COVID, but our healthcare system, all of it. We only have so many beds, so many doctors, so many resources, and so many ICU spaces available. But COVID doesn't care about our capacity, yet our capacity is not unlimited. What does this mean? Well, as I've said before, this isn't entirely about whether you or someone you love contracts COVID. This is about whether you or someone you love needs emergency life-saving care for any reason. We're nearing the point across Ontario where medical professionals may well be placed in the unthinkable position of having to choose who receives such care and who does not. Can you imagine having to make that kind of decision? Can you imagine being told the decision went against your loved one? That's the severity of our situation, and that's why we absolutely must clamp down. Even seemingly small things can make a big difference. For example, lately we've received a growing number of complaints about people using basketball courts for games or scrimmages. Now, by the way, we've said people should be out and enjoying themselves in the open air, and exercise is a good thing. But while the courts remain open, they're meant to be used for individual play, not games, not practices. In addition to large gatherings on courts, we've also heard about others who are huddled close together to watch those games from the sidelines or waiting to use the court next. Look, love basketball. I was never any good at it, but it's not a time to gather for basketball or for any reason. And if the lack of compliance continues, well, we're not going to hesitate to take steps as we need to. And we don't want to close the courts because that does provide some real opportunities, but if necessary, we'll do what we need to do. We want to keep people safe. That's the bottom line. We need to keep our healthcare heroes from burning out, and we simply can't do that unless or until people appreciate and meet the seriousness of the moment. Now, frankly, I know that over this past, year plus, I'm preaching to the converted, but I need your help. I need you to help me get the message out to those who are not listening, those who do not seem to feel the rules apply to them. Help me help London by helping those individuals. And in that case, in that way, we help ourselves. So that's it for now, and I'll turn it over to Dr. Summers. Thanks very much.
Thank you, Mr. Mayor, and hello to the media, and greetings as always from Dr. Mackey. The Middlesex-London Health Unit is reporting 151 new cases today. This trend continues. We are certainly in the midst of a pronounced third wave here in the Middlesex and London region after reporting our highest daily case count yesterday of 176 cases. We're also reporting an increased number associated with the B117 or UK variant. That would now be the predominant strain seen in our community. And many of you will note we're reporting a second P1 or Brazil variant today. That second variant, P1 variant, is unrelated to the variant that was reported yesterday. We are still investigating. It does appear to be travel associated or travel linked as well. However, it reminds us that not only is COVID remaining present in our community, but so too are these variants. The stay-at-home order has now been in effect for over a week. We know that it will take 2 to 3 weeks for us to see the full impact of the stay-at-home order, assuming we as a community adhere to that stay-at-home order. Building off of the mayor's comments, we invite people to be active outdoors, but do so in such a way that you are only interacting with those with whom you live. It is absolutely critical that we keep our social circle small and contained to that with whom we live so that we can continue to see the success of this stay-at-home order come into full effect. The vaccine rollout does continue. As you know, we opened to 60 plus on Tuesday. And in order for us to continue to have the success, we would encourage anybody who is eligible to make sure that they book a vaccine appointment and get their vaccine as soon as they can. New appointments continue to become available daily. If you haven't had an appointment yet, I encourage you to try every morning. And I recognize that it's a bit frustrating. However, the vaccine continues to roll out and new appointments do become available. In addition, we anticipate more and more pharmacies in our region will be offering the AstraZeneca vaccine. We heard good news from Health Canada yesterday, affirming that the benefit of that AstraZeneca vaccine far outweighs the very rare risk associated with blood clots. That AstraZeneca vaccine, if available to you, I encourage you strongly to take advantage of it and get that vaccine. It is a very effective vaccine at preventing hospitalization and death, and as a result, it plays a critical role in protecting our healthcare system from being overwhelmed. So if you are eligible for that AstraZeneca vaccine, please take advantage of the broadening opportunities that will be available to you over the next couple of weeks in pharmacies in our region. These are certainly tiring days. We've been at this for a long while now. There is a light at the end of the tunnel, but it will take both our commitment to that stay-at-home order as well as seeking out the vaccine when the opportunity arises in order for us to continue to get through this pandemic together. Thanks so much, as always, for joining us today, and I'll pass things back to Mr. Flaherty for the questions. Thanks so much.
Thank you, Dr. Summers. Thank you, Mayor Holder. Well, we do have a lot of questions, so let's get into them right away. The first question this afternoon is from Jennifer Beeman at the London Free Press. Dr. Summers, this one is for you. How many appointments have been snapped up by the 60-plus crowd since Tuesday, when the age group became eligible to book their vaccination appointments?
Thanks for that question, Jen. We continue to track that number hourly. It changes, as you might imagine, as we continue to see people book. We entered Tuesday morning and broadened out our booking timeline to 4 weeks, and we entered with approximately 9,000 to 10,000 appointments available. Each and every day we add an additional 2,000, and this morning we had about 4,000 spots. So I estimate somewhere around 10,000 spots have been utilized already by that crowd, and we continue to see more and more appointments become available. We've had tremendous uptake, and although I recognize that that means that people do have to wait a couple of weeks from when they become eligible to receive an appointment, the good news is that we will get to you and you will get your vaccine. We'll try and get some more up-to-date numbers on that over the course of the briefing today, but thanks again for that question.
Let's go to the next question, and it's a follow-up from Jen Beeman. Dr. Summers, I know NLOC was originally supposed to be administering Moderna vaccine. Is the unreliable supply of Moderna, specifically delayed shipments, a curveball here?
Thanks, Jen, for that question. We have had to modify the type of vaccine that is delivered at NLOC from Moderna to Pfizer in order to ensure that we're balancing the amount of inventory coming in with the amount of appointments that we have. The Moderna deliveries are somewhat unpredictable. And so we do try and schedule appointments around a window of delivery so that we don't have to cancel appointments. We did, though, transition NLOC to Pfizer mainly because our supply of Pfizer was higher. So again, we're trying to use as many appointment slots at one go as we can, and we will modify the type of vaccine delivered at any of our MassVax clinics as necessary in order to fully get that vaccine out the door. We may see, if Moderna supply increases, NLOC once again distributing the Moderna vaccine in the near future.
Thank you, Dr. Summers. Let's move on to one more follow-up from Jen, and then we're going to go to some of the other questions. Jennifer asked to follow up, Dr. Summers, with the 60-plus age group now booking, what will be the next group to become eligible for appointments at the mass vaccination sites? When is the health unit expecting to open up bookings for that population?
Thanks for that question, Jen. The provincial government sets the direction for the eligibility criteria. We, at the local level, modify that timing depending on the inventory supply that we have. We're obviously in phase 2 as we speak, and phase 2 was divided into 2 halves. The first half focused on those over the age of 60, high risk and at-risk health conditions, as well as staff, essential caregivers, and residents of high-risk congregate settings. At the moment, we are close to being through that group. We will be making eligible the remaining eligible health conditions at some point over the next couple of weeks. The timing of moving to that cohort will be dependent on the uptake amongst those over the age of 60 and those that are already eligible. I would highlight that those over the age of 55 are eligible to receive AstraZeneca at those pharmacies, and we will see increasing opportunities for people to book in pharmacies over the next week or 2. So again, the next eligible crowd will be likely the remaining eligible health conditions as dictated by the province, and then we will reassess and follow the provincial direction regarding essential workers who cannot work from home.
Lots to consider and lots to watch for in the next little while on the vaccine front. Let's move down the questions to Daryl Newcomb at CTV News. I think, Dr. Summers, this may start with you, but Mayor Holder, I think there's going to be some of this for you as well. Can you provide an update on local enforcement activities related to the stay-at-home order? If the current stay-at-home order is working, when should Middlesex-London begin to see daily case counts decline?
Thanks for that question, Daryl. Enforcement of the provincial direction and this provincial stay-at-home order is a combined effort of many partners in our region, including bylaw enforcement, the police, and of course public health as well. We do continue to follow up any complaints regarding a lack of adherence from business or operators or the public with regards to the stay-at-home order, and it is a collaboration of all those groups that I mentioned to ensure that we do have adherence to this really important action. It typically would take 2 to 3 weeks to fully see the impact of the stay-at-home order. This is because it can be up to 2 weeks after someone has been exposed to COVID-19 for them to become symptomatic and be diagnosed with that illness. So we need to have that 2-week window in place to fully see the effect of that stay-at-home order. And we experienced that back in late December and early January. 2 to 3 weeks after that stay-at-home order, we did see case numbers plateau and begin to fall. It was a highly effective method for reducing the case counts across the province and certainly here in the Middlesex and London region. And we anticipate, again, if people are adherent to those orders, that it should also work here. Mr. Mayor, you may have some to offer there as well.
Well, I appreciate it. Thanks, Dr. Summers, and I appreciate, Daryl, the question. We are relying primarily on self-enforcement when it comes to responsible behaviors during the stay-at-home orders. And I think the other part of that is that the flip side is that congregating in homes is also the challenge. So I'm talking about groups that are not related, groups that are not within your bubble. If there are in that secondary component if there are individuals that are congregating in large numbers. Frankly, our bylaw enforcement will be there to do what needs to be done to break up such groups. But this is the kind of thing from a medical standpoint. I'll rely on the health unit and Dr. Summers' comments that the amount of time it would take to see daily case counts decline as a result of stay-at-home. But it doesn't stop the point about the reliance on self-enforcement. If we can get to that stage where we're paying attention to that, then dramatically numbers will decline. But it does take that level of cooperation with everyone, and we sure hope people get it. That's the critical piece to make this work.
Thank you both for those responses. Let's go to our next question. Carrie McKee has that. It's Carrie, of course, with CBC London. And Dr. Summers, you get into a groove on these things. This one is going to be for you. The Ministry of Long-Term Care is being asked to make space to admit or readmit hospitalized patients to their facilities due to the rising number of COVID patients. Is that happening here? Are long-term care facilities able to take on hospitalized patients? The Ministry of Long-Term Care said, our goal is to complete at least 1,500 placements across the 626 long-term care homes in the province.
Thanks for that question, Carrie. There is a concerted effort happening across the province right now amongst our acute care partners and our long-term care home partners to ensure that hospital capacity is available for those that need it, given the rising case counts and increased hospitalization from COVID-19 that we are seeing. So the request from the Ministry of Long-Term Care is across the province and will be in place here in the Middlesex and London region. Again, the hospital would be able to speak more specifically to this process, but certainly there are often patients for whom a transfer from hospital to a long-term care home may be expedited in order to make additional bed space within the hospital. The good news is that our long-term care homes, probably for the first time in over a year, are in the best position yet to be able to take more people in because of the success of the vaccination program. One thing to highlight during this third wave is that the impact of the vaccination program on outbreaks and cases and deaths in long-term care has been unbelievable. The success of that vaccine is remarkable. And as a result, it means that long-term care homes are now have that extra layer of protection where we can be more confident with regards to admissions. Again, I know our long-term care home partners can speak to this certainly in greater depth than I can, but I'm sure they'll be working to comply with that Ministry of Long-Term Care request so that we can ensure that our hospital partners have the space they need to provide the care that we want them to be able to provide.
Thank you very much, Dr. Summers. Let's move to our next question. Andrew Graham is joining us from Global News Radio, AM 980 CFPL. Dr. Summers, how many Cargill employees have now tested positive for COVID-19?
Thanks for that question, Andrew. We are reporting today 87 total cases associated with that Cargill outbreak. We met with Cargill again today. As you know, that processing facility has been idled. An entire department has been placed into quarantine because of the transmission we've seen amongst staff within that department. The 2-week idle period is critical, absolutely critical, in ensuring that that outbreak is brought rapidly under control. There is no substitute for distance between two people when it comes to COVID-19, and idling that facility will allow for that to happen. But the number as it stands is 87.
Dr. Summers, a follow-up question from Andrew Graham. And I don't know if this is information you have at your fingertips, but Andrew is asking if you can provide updated numbers for how many current COVID-19 inpatients at LHSC are from out of the region.
Thanks for that question, Andrew. That would be a question best directed to London Health Sciences Centre.
All right, and let's move on. This is from Matthew Trevithick at Global News Radio 980 CFPL. As Mayor Holder noted, Dr. Summers, 57 COVID-19 patients are in hospital with 24 in intensive care, an ICU tally 3 times higher than the last time LHSC saw 57 COVID patients in their care back in December. What do you make of this increase?
Thank you for the question, Matthew. I believe the mayor said it well. Overwhelming increases within our hospital system are a significant concern for all of us. One of the objectives of all of the work that we've done as a community over the last year has been to ensure that our hospital system has not been overwhelmed. In addition, of course, to ensure that we don't have as many people as could have been die from this illness. So when we hear of those numbers, it's of significant concern. And as we heard on Monday from Dr. Duclos at London Health Sciences Centre, they are unfortunately having to put contingency plans into place to support both admissions from our community as well as from others across our province. They're very concerning things to see. They are reflections of the high case count we are seeing day in and day out here at the health unit, and they're reflections of the fact that COVID-19 is transmitting readily in our community. Now is certainly not the time to be idle, and those numbers really highlight that for me.
Thank you, Dr. Summers. Kate Dubinsky from CBC London has a question. Dr. Summers, can you update us on the status of active cases at Western in residence and also at Cargill, which you just mentioned, the 87 cases there? Are there other outbreaks at large institutions that we should know about?
Thanks for that question, Kate. We haven't seen a significant change in the numbers at residence outbreaks over the last couple of days. We are starting to get to the end of that outbreak period. Many residents, people living in residence, have returned home. And as a result, with increasing distance and a reduction in the amount of people in a congregate living setting, the numbers are declining quite a bit. So that's some good news. And as we know, that drove quite a bit of activity within that N6A postal code. And so it is certainly good news to see that those numbers are reducing. With regards to the question about other outbreaks happening in our community, one of the things that we do at the health unit is ensure that if there are outbreaks in which not all close contacts can be individually identified, you will hear us publicly disclose those outbreaks so that people can self-identify to have potentially been exposed. For example, you may recall that when there's been an outbreak amongst a retail environment like a grocery store, we have spoken publicly to that to ensure that people who may have attended that setting are aware and are able to take appropriate precautions. In many workplace outbreaks, and we've had many over the course of the last year, we are specifically able to identify all the close contacts that may be implicated in those outbreaks. Cargill is one of those examples. Cargill is not open to the general public, so we are actually able to identify everybody who might be at risk because they are known to be in the employ of that company. The same is true for many workplaces, and that's typically how we've approached it. You, I know, have mentioned as well that there's been a workplace outbreak we've been following at Western, and certainly we've been following that closely. That is one of those outbreaks that is contained amongst employees, and so we're able to specifically identify close contacts in that instance.
Thank you, Dr. Summers. A couple more questions from Jennifer Beeman at the Free Press. Dr. Summers, the hope was that we'd have an increasing vaccine supply through the spring. Is the health unit concerned its vaccine supply will be held at the same levels or reduced over the coming weeks as the province focuses on expanding eligibility in hotspot regions of Ontario?
Thank you for that question, Jen. As an associate MOH, I want my hands on as much vaccine as I can possibly get. And so certainly, as we know that there is only a finite amount of vaccine coming into the province and that there have been hotspots identified, it is of concern that we may see some reductions in our vaccine supply here locally. We continue to highlight our numbers here. They've certainly been high. And I know that the province is aware of the high amount of activity that we have seen here. We too have a desperate need for as much vaccine as we can get. We send it out the door as quickly as we receive it. We are working with primary care. We are supporting pharmacies in their rollout. and we hope that we can see as much vaccine as possible. We advocate for that vaccine in our community, and I know we're supported by other leaders in our community to ensure that London and Middlesex gets its fair share as we continue to deal with the high numbers of cases that we see. We also know that there are other parts of the province that have had case numbers that exceed even what we have experienced here, and we understand the need to be appropriately distribute vaccine through the province. But it doesn't mean that we don't advocate for what is happening in our community. And again, when that vaccine comes here, we also know that people in the Middlesex-London region are going to be eager to roll up their sleeve to get it. For those, again, and I'll highlight this one more time, for those of you who are eligible to receive AstraZeneca, make sure you go out and do so that we can demonstrate to the province that we are ready not only to send vaccine out the door, but as a community, we're ready to take it too.
And before we move on, Mayor Holder, I know that you have been very active in advocating for the community as well when it comes to matters of vaccination and attention with regards to the number of cases we have been seeing lately. I wondered if you wanted to add a comment or two to this discussion.
Well, I think the point Dr. Summers makes about ensuring that London gets its appropriate share is a very legitimate one. Certainly in my discussions with local ministers and the Premier, we've made that point absolutely clear. And in turn, the Premier has indicated that strongly that London and Middlesex region will get its appropriate share as well. So that's the back and forth. We know that with hotspots that there seems to be a priority allocation, and one of the things that we recognize that when GTA and area represent over half the population and they are considered a hotspot, we know that that part of the province truly must be fixed. At the same time, London has an extremely serious issue with respect to the N6A and broader London region. And my absolute priority has to be and is for London, to make sure that we get our share. And that's the discussions that both the health unit has at its level and I have at my level. And we hope to get to the right place. But it does make the point, if you're eligible, take the jab, get the shot. That is so critical to do that. And, you know, take some pressure off of the system by doing that. And for fear of sounding like the tired record that never stops, do the things that we've always said. Do not congregate. Do not engage in activities that are contrary to physical well-being and health. So wear your mask, self-distance, do the hygiene practices, and do it. I mean, that would be my comment. And you know, we're our best enforcement. Our actions are even more critical than the vaccine if we would all take personal responsibility. And because we don't, it's why we have to take the vaccine as well.
Thank you very much to both of you for those answers. We do have a couple of more questions, so let's get through those quickly. Dr. Summers, another question from Jennifer Beeman. Health units have some ability to target vaccinations based on local need. Are there any specific populations the health unit will be targeting in this next segment of phase 2, such as Cargill employees?
Thanks, Jen. Currently, high-risk congregate settings are an eligible group for which we are trying to dedicate mobile team services to make sure we vaccinate. So for example, individuals living in homelessness is one group that we are really wanting to make sure we provide vaccine to. They are an eligible population at this time. However, we know that getting to a mass vaccination clinic isn't always so easy. So our mobile teams will be working with our city partners and others to ensure that we are offering vaccine in that community. That will be a key area of focus. Additionally, there are other high-risk congregate settings, group homes, for example, where we will be dedicating some specific resources. As we move into the next group of workers who are not able to work from home, and again, the province will help us know when the appropriate time is to move into that group, we will certainly be looking at spaces where people aren't able to physical distance, and folks working in a facility like Cargill are some of those groups as well. So certainly we'll be looking towards getting vaccine as we can into those higher risk groups as soon as we can.
Thank you very much, Dr. Summers. Let's go to a question from Matthew Trevithick at Global News Radio, AM 980 CFPL. That's another Cargill question. Dr. Summers, has the Middlesex-London Health Unit seen any secondary cases tied to the outbreak at Cargill, such as in members of the broader community?
Thanks for that question, Matthew. We continue to investigate. At this point, we've seen very little secondary transmission into the community at this time. I do anticipate there may be some household transmission amongst cases. Seems like something that will happen. However, at this point, we've seen very limited secondary transmission.
And our last question, Mayor Holder, is for you, and it's also from Matthew Trevithick. Mayor Holder, have you heard anything back from the province when it comes to designated N6A or any other area of London as a COVID-19 hotspot?
Well, hi, Matthew. Thanks for the question. Look, what we do know is that GTA has been an absolute focus for the government because of the concentration of individuals relative to the whole population of Ontario. But they've heard very clearly that it's important that London is recognized. By the way, it's not a designation we wear with any pride. It's a tragedy, but and the province is empathetic to that as well. So as vaccines become available, it's my belief that that will have some real impact on us being declared a hotspot as needed. What we really need to see, though, is a downward trend on the case counts. We truly do. So as much as my first comments earlier today where case counts are being supplanted by issues around hospitalization rates, case counts still matter as well. And so if we can pay attention to both, but from our standpoint, the province is absolutely aware, and whether that ultimately means in London becoming or being declared a hotspot, I'll just ask us all to be a little bit patient with that, and our work with the province will continue in that regard.
Thank you very much, Mayor Holder. And that does bring us to the end of our questions for today and the end of our time as well. So we want to thank you for joining us for this virtual media briefing. We will be back on Monday afternoon at 2 p.m. So between now and then, have a great rest of your day. Have a great weekend, and we'll see you on Monday afternoon. So long for now.